Hello, everyone. I just wanted to introduce you. This is going to be a video of me getting my blood done. And then we are going to go into a video of an interview with the doctor. And if you guys have any more questions, he said he's happy to answer them. So go ahead and post them down below. Please subscribe. I need to get this going. I want to hear other people's stories. So I'm going to go ahead and present this video. And I'm also going to be providing some more informational videos as I continue to update and make this channel 100% legitimate, so we can really help people get through this process, because it is not an easy process. Okay. I've thrown up almost every single day, but you know what, it's worth it. Okay. And you can do it. And there are days I was watching where I look out of it, and it's just some of the side effects of the medicine. Okay. Sometimes I get some bruising, some other things like that, but I'm going to go into that on another video too. Okay, so this one's gonna be about my blood and my results, and a few questions I asked the doctor. So here we go.
That and this is a nice way to see it. So we're okay here.
Yep.
So before you started, so July of last year, you had 3,000 copies of the virus in every milliliter of blood. So every 30 drops of blood or so.
Wow.
That's still relatively low. Some people run it above 100,000. Many people run above 1 million. Okay.
Wow.
But at June 15th, so you started your treatment May 9th. So yeah, this was about 5 or 6 weeks in. That what this says is it's so low that we can't measure it all. We can't count it up. It's not detected. So that's in your blood. That means the treatment's working for you. Okay. What it doesn't mean is that it's gone from your body completely. So that's in your blood. Could it be sleeping inside some liver cells in your liver? Maybe. That's why we're continuing with this last half of your treatment.
Okay.
Could one of those cells wake up and start cranking out Hep C virus a week or 2 or 10 after you finish your last dose? Possibly. That's why we test you 12 weeks after your last dose. So you missed 1 dose during your treatment, so we're going to add a day to your treatment. But if you don't miss any other doses, you would finish up August 2nd, and then October, or so before Halloween, we would do blood work, and we would find out whether or not it worked and whether you're cured.
So we'll go over that again, and then what happens if I have it still?
Yeah, if you have it still, we can treat you again. The other piece I wanted to show you here is, look at this. So let me show you a different way. So this is an ALT. It's the way it's just a marker of liver inflammation. For most men, normal is below 19 or so. And you can see you've kind of bounced around. So
Yeah.
5 years ago was in the 500s, 4 years ago in the 200s, a year ago before treatment was 70. It hasn't quite normalized, but has gone down to very close to normal for men. And I expect that will continue to go down. In addition, as you continue to lose weight, that stress on your liver will improve, and your liver will continue to get healthier and healthier. So that's another way to show me that your liver, that the treatment is working and working safely, and then your kidney function, everything else looks good.
And that actually helps with my GERD a little bit too.
Yeah.
So people with stomach issues, something to consider.
Other things that you could do to keep your liver healthy, again, it looks like you're protected against hepatitis B, but you might benefit from hepatitis A, which you have less control over. And again, staying away from alcohol, weight loss we talked about, and just again a healthy diet. So I can't think of too much more to.
No,
do they
you're
have
wonderful.
to double the medication when?
Oh yeah, if it doesn't work.
If it doesn't work,
Yeah.
so does it make it harder, and is the treatment longer?
It depends. So again, 95+% chance this treatment will work for you the first time around. Your goal is not to miss any more doses than the second, last 4 weeks of your treatment. if you're one of the unlucky 5 out of 100 people for which it doesn't work, we would repeat some resistance testing. You didn't have any resistance before you started. We would double check and make sure. There is a medicine likely to be approved by the FDA next month.
Oh, wow.
And it seems to work very, very well, like 97% of the time, for people who failed Zepatier with your genotype with very minimal side effects. So
excellent.
in the past, our treatments were a handful of pills with more side effects for people that failed your current treatment. But I think everything looks likely that this is going to be approved. If it's not, again, we would talk about treatment. It would probably be 7 pills a day for 12 to 24 months. But my guess is we're going to have an even newer, better, safer, simpler option approved sometime in August. Yeah.
Wow.
Hep C treatment 10 years ago, it was shots that lasted a year or a year and a half with a handful of pills and a whole lot of side effects, and it didn't work very well.
Wow.
So I don't know where you get your information. I really like this website, Hep C Advocate. I don't know if you found that. So hcvadvocate.org has all kinds of really great stuff. It's got things at a doctor level.
What's
it's got fact sheets for people that this is at a 3rd grade reading level. We've got fact sheets at an 11th grade reading level.
Theadvocate.org, and that's where you guys can learn some more information.
Yeah, so there's all kinds of websites, and but I think that's my favorite one. That's where I get my information, but they have really great information for people living with HIV. With hepatitis C, and for people who have been cured or in the process of being cured, and information to encourage other people to get tested. So that's kind of my favorite website. And again, it's got up to the minute information.
What's coming out next and things like that. Okay, great.
So let's see actually if so again, this was just from Saturday, and it's talking about the new drugs. And again, these are all going to work for all genotypes. Okay, so this one will be 8 weeks for everybody starting out. This combination is what I was talking about. So for people who, like say this doesn't work for you, you will have experienced these direct-acting antivirals, and if it didn't work, and between genotypes 1 and 4, again, to take this new medicine, this is 97% chance of being cured with the new one pill once a day.
Yeah. So it's pretty much, it's 99%, in the end, as long as you follow. Hey everyone, I hope you enjoyed that video. Sorry about it cutting off there. So basically, you just got to make sure you follow through. You take all your medications. And like I said, if it doesn't work out for you, you're part of that 5% chance. There's another shot where you have another 99% chance of being cured. So, it's amazing. So I'm just grateful for what we have. Please post your stuff. Let me know how you feel about this video. I'm going to be coming out with some more quality ones. Thank you for your time, and I look forward to seeing your questions. Bye.